Hydraulic penile implant ZSI 475 preparation. 1. Preparation of the penis, the scrotum, and the pelvis for implantation of the penile implant ZSI 475. The patient is placed in a supine position. Insert a 16 French Foley catheter. Perform a penile-scrotal incision. Expose the tunica albigina of the corpus cavernosum to achieve deep exposure of the proximal corpora. Make an incision in each area. Carefully prepare the distal part of the corpus cavernosum with the scissors closed. Carefully prepare the proximal part of the corpus cavernosum with the scissors closed. Dilate the distal part of the corpus cavernosum with dilators from 10 French to 13 French using Heger candles. Dilate the proximal part of the corpus cavernosum with dilators from 10 French to 13 French using Heger candles. Measure the length of the distal part of the corpus cavernosum with the introducer ruler. Measure the length of the proximal part of the corpus cavernosum with the introducer ruler. Add the two measurements for the total length of the corpus cavernosum. Prepare the scrotal pouch for the pump of the penile implant utilizing subdardos pouch. Perform an inguinal incision for the implantation of the reservoir in the pelvis. Follow the spermatic cord with the index finger to reach the pelvis. Then, create a space for the reservoir in the pelvis, beside the bladder. To prepare for the passage of the armed tubing under the skin, join the penoscrotal incision and the inguinal incision with a finger or dissect with a Kelly. 2. Preparation of the corpus cavernosum prosthesis and the pump. Supply and instrument requirements. A bowl with saline solution, a bowl with antibiotics, a 60 milliliter syringe, the cylindrical needle. Change gloves. Only the surgeon should touch the device. Open the kit. Prepare the corpus cavernosum prosthesis. Screw the inflatable distal parts to the proximal parts and the pump. Repeat the procedure with the second inflatable distal part. Squeeze the pump to fill the assembly with normal saline solution. Remove the air in the saline solution from the prosthesis, squeezing the valve and the inflatable parts at the same time. Place a clamp on the tubing to avoid letting air back into the assembly. Minimize the time the device is in open air. Plunge the assembly in antibiotics. The assembly is ready to be implanted. 3. Preparation of the reservoir. With the 60 milliliter syringe and the cylindrical needle, inject normal saline solution in the reservoir. Remove the air and the saline solution from the reservoir. Place a clamp on the tubing to avoid letting the air back into the reservoir. Plunge the reservoir in antibiotics. The reservoir is ready to be implanted. 4. Preparation of the needle and the introducer. Place the suture into the eye of the needle and go through the hole of the inflatable distal part. Warning: do not pierce the inflatable distal part. Remove the needle. Repeat the same procedure with the second inflatable cavernous distal part. Place the two ends of the thread into the eye of the needle. Introduce the bottom of the needle and the thread in the introducer. Push with the spatula to introduce completely the needle. 5. Implantation of the penile implant. Place the introducer into the corpus cavernosum. Push the needle through the glans penis with the piston. Pull up the needle and remove the introducer. Inject local antibiotics in the distal part of the corpus cavernosum. Inject local antibiotics in the proximal part of the corpus cavernosum. Introduce the prosthesis into the corpus cavernosum. First, insert the proximal part, then the distal part. With the thread, pull up the distal part of the prosthesis into the corpus cavernosum. Place the reservoir into the pelvis and pump into the scrotum. Cut the thread and remove them. Fill the reservoir with a maximum of 80 milliliters. Place the pump and the scrotum into subdardos pouch. Pass the armed tubing under the skin through the passage. Connect the armed tubing together. Close and remove the Foley catheter after 24 hours. 6. Connection of the armed tubings. To ease the connection, soak the armed tubing, the connector, and the rings with saline solution. Connect the armed tubing with the connector. With the fingers, push the ring to the connector to secure the connection. The reservoir is connected with the pump. 7. Choose the length of the corpus cavernosum prosthesis. 3 inflatable pairs of distal cavernous prosthesis are available, 13, 16, and 19 cm. If a 12 cm is required, cut 1 cm of the proximal part of the cavernous corpus prosthesis at the mark. To increase the length, proximal and distal extensor are available. For length between 13 to 21 cm, 19 plus 3, use proximal extensor of 1, 2, 3 cm. For length over 21 cm, use distal extensor of 1 or 2 cm. Turn the flap inside out. Place the distal extensor with the flap inside out over the top of the inflatable part. Soak the extensor and the inflatable part to ease the connection. Push back and place the flap over the inflatable part. Pierce the extensor flap with the needle to go through the hole of the distal part. Example: length of 17 cm. Use the 16 cm inflatable distal part plus 1 proximal extensor of 1 cm. Length of 15 cm. Use the 13 cm inflatable distal part plus 1 proximal extensor of 2 cm, or use the 16 cm inflatable distal part and cut 1 cm of the proximal part of the cavernous corpus. Length of 24 cm. Use the 19 cm inflatable distal part plus the 3 cm proximal extensor plus the 2 cm distal extensor. For more than 24 cm, add more proximal and distal extensors. Example: same length with proximal or distal extensor. The armed tubing exit is not at the same level.